Tonight, RTV6 is looking deeper into one of the effects of COVID-19 that can mean life or death for people who are praying for a miracle.
And patients who need a life-saving organ transplant, many industries have had to adapt during the pandemic. For those in organ donation, there was even more pressure to figure out how to keep it going in order to save lives. RTV6's Stephanie Wade explains how transplant centers here in Indiana are continuing those essential surgeries.
The Indiana Donor Network says there was an initial decrease in organ donation when the pandemic first hit. But since then, they've completed 167 organ transplants, saving dozens of lives right here in Indiana.
I'm feeling great. I'm recovering pretty good.
Last month, Harold Herndon got the call he'd been waiting for almost a year.
Actually, they had called me that Tuesday and said they had a kidney available. Would I accept it? I'm like, well, I'm going to call you in the morning. And they said, well, make your mind up.
Herndon says he did have some concerns going through with a major surgery, receiving a kidney transplant during a pandemic.
I had to pray about it and think about it. And I'm like, this is an opportunity to change my life. So next morning we called him, set it up.
But says the doctors and nurses at St. Vincent Hospital set his mind at ease.
They have a transplant team, and that team is it's awesome. I have to say so myself. Everyone just made me feel so comfortable. They took the time to talk to me, explain everything to me.
We know that donation has to continue to happen. It's essential, and we have to continue to save lives through transplant. So how can we make that happen?
The Indiana Donor Network says they immediately partnered with the State Department of Health to create a speedy 12-hour turnaround time for testing potential donors for the coronavirus. They and the hospitals had to completely reevaluate their process in how they were going to safely handle organ transplants, separating COVID patients from donors.
We are taking every possible precaution. We are not only doing the lab testing, we are reviewing imaging of the donor's lungs with a pulmonologist, our chief medical officer. We are reviewing all of those signs and symptoms, asking the donor's family if they had any of those symptoms.
Working tirelessly to give Hoosiers a chance at living a full life.
I would encourage anybody that's on the fence, step out on faith, go ahead and do it. It will change your life.
Stephanie Wade, RTV6.
And 20 people die each day waiting for an organ. Every 10 minutes, another person is added to the transplant waiting list. You can save 8 lives through organ donation and heal 75 lives through tissue donation. Anyone can register as a donor. To learn more, visit IndianaDonorNetwork.org.